Crazy complicated colitis. This presentation describes the case of a 60-year-old gentleman with a known history of ulcerative colitis and previous bout of Clostridium difficile infection, whose colitis was not improving with standard therapies. The gentleman initially presented after being found to have a pulmonary embolism, where he underwent mechanical thrombectomy and IVC filter replacement, and was started on a heparin drip, which exacerbated his hematochezia. Initial CRP was found to be 20.5, which increased to 81 on hospital day 5. The patient was changed to IV steroids as it was thought his underlying UC was in flare, but the patient did not improve. With repeat C. diff showing a positive result, the patient was switched from vancomycin to fidaxomicin, but again did not improve. CMV PCR was obtained and found to be elevated, but IgM antibodies were negative. Flexible sigmoidoscopy was performed and showed severe oozing shallow linear ulcers. Biopsies obtained showed inclusion bodies on immunohistochemical staining, which is diagnostic of CMV. The patient was started on IV ganciclovir and soon began to show rapid improvement of his symptomatology. While steroid refractory UC has been shown to have a correlation with CMV, this is not often immediately pursued in initial diagnostic workup. This case underlies the importance of pursuing further workup in a patient who is not responding to standard of care therapies and in whom the diagnosis in question may be doubted. While UC also has a known association with C. diff, the culmination of UC, C. diff, and CMV is rarely documented in the literature, and it is important to consider that multiple pathologies may coexist when the clinical picture is not showing the improvement as would be expected.